Hi, my name is Kevin Noble. I'm a licensed physical therapist in the state of Florida. I've been practicing for about 3 years in South Florida. I've worked home care, I've worked outpatient ortho clinics, and I've worked hospital orthopedics.
My name is Kristen Sicosio. I'm also licensed physical therapist in the state of Florida, practicing in South Florida. I've been a physical therapist for about 7 years now, and I practice in outpatient orthopedic clinics, outpatient neuro clinics, and home care as well. So we wanted to endorse the KneeSled, which is a simple, easy to use at-home device that helps optimize your recovery.
Part of the reason I love the KneeSled is that it helps restore full flexion extension to the knee, particularly flexion, at home, especially for those patients that just don't have enough visits to come in every single day.
And for me personally, what I've seen in doing home care is that patients don't have the tools needed to achieve that heel slide that is a very important factor after a knee replacement or any other kind of knee surgery. So patients will often use pillowcase, a towel, a belt, and all of those things. While they can work, it doesn't achieve the optimal alignment of the foot. It doesn't achieve the optimal knee flexion because that's just not what it's made for. One of the first exercises that your physical therapist might have you perform following a knee surgery is a heel slide. The KneeSled is an optimal mobility aid that can help you achieve this heel slide into full knee flexion in proper alignment of your ankle, knee, and hip to fully achieve knee flexion.
Not only does the KneeSled work on range of motion, the KneeSled also promotes strengthening through resistance bands. Oftentimes as physical therapists, there are exercises we would like our senior citizens especially to do at home. However, we do not prescribe them because of the safety concerns. The KneeSled allows these patients to strengthen from the safety of their bed without the risks of fall or injury.
In addition to just a basic heel slide, the KneeSled allows patients to mobilize and strengthen their knee and leg in a variety of different planes of motion, such as an air bicycle to help promote proper gait mechanics and stretches to their hamstrings and glutes.
The KneeSled is ideal for diabetic patients because of its ability to offload the heel. It's also ideal for arthritic patients because of its ability to strengthen and stretch the knee without being in load-bearing positions.
And that'll help preserve a patient's current knee to try to put off any surgery for longer periods of time.